Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the dental brokerage for 15 years. So today's topic is buyer of a dental office has no appreciation or respect for the
police reported ahead
of a dental office. They don't know what they will be missing. We'll get into that. As you know, we now are in 25 states. We have 10 employees and we work every day except Christmas and Easter. So feel free to call us at any time. Be happy to help you. 201-663-0935. And our website is dentalpracticeguide.com or nationwide dentalpracticebrokers.com. Now, you can call us anytime. We work 363 days a year, so call us even if you just want chat or you want a little advice. Happy to give it to you.
Police reported ahead
of your practice, whatever. Sorry for the recording. We work all the time. So, if you have a large practice and you're thinking about selling to one of the large DSOs, you're doing over $1 million, have 5 operatories or more, willing to stay on for a few years, 3 to 5, could be an opportunity for you to sell to the larger DSOs. And we work with them all the time. So give us a call and we could talk to you about that. We know everything about them. They will often pay our commission, so generally be no commission to the seller. So call us and we can give you more details on that. Also, any practice that we represent over $1 million, we can often reimburse your legal fees based on successful closing. And we've done that multiple times. We want you, and based on very minor criteria. All right, so anyway, moving forward, what happened here? I'll give you the story. Obviously changed some of the issues, some of the details around. So the doctor had sold his office, seller had sold the office to the buyer a few years ago. They wanted the doctor to stay on. He continued to stay on, or she continued to stay on for a period of time, a few years. Then, abruptly, the seller, who was now an employee, and they used to be a part-time associate there for a couple of years, and on top of that, the seller would also help the buyer. They would do joint lectures together, to try to recruit patients, try to get referrals. They would do joint things together often. So it was a good relationship. And they'd put these lectures on. It was very good for the buyer because the seller had all the knowledge. And slowly the buyer started talking more and more and building up his confidence in the field of specialty that the general dentist had. So one weekend, abruptly the seller, the buyer, the office that, who was the buyer of the office, the seller was the employee, sends a text message or something like that on a weekend and tells or overnight, whatever it was, tells the doctor, who was the employee and was the seller, that he sold the practice. That's it. The records are getting transferred. I have no idea if the new doctor needs you or not, but they didn't ask me about it. So the seller says, well, don't you think you should have told me about this before, that something was pending? At least give me a little idea to, change my schedule and adjust and so forth, rather than just, giving me a message on the phone, the practice is already sold. It's already gone. And that's what the seller asked for. And the buyer responded, well, there's no need for that. You're an employee and it's my practice. I'll do whatever I want. Okay. So what do you think when he said that phrase? This seller had been at the practice for 38 years or 40 years or whatever. Knows all the patients and has continued to treat the
Police reported ahead.
employee. Right? So you would think there's some not only goodwill from the original sale, but continuing goodwill because the buyer didn't really work there that often. Now, one thing leads to another. The seller's piece upset now. You're getting treated like, garbage. Like, get out of here. I own the practice. You're only an employee. Well, I don't think that's the way you should treat that seller. Unbeknownst to the buyer, the seller tells me the buyer has no clue what he's missing now. I had a good relationship with those patients. Secondly, I helped the buyer on all those lectures we did together. And apparently the buyer thinks now that he could do the lectures himself and will not have to reimburse the seller. Well, it's great to have a little attitude like that. But this could lead to big problems because I don't think the buyer was really ready to take it on. He may have thought he had enough confidence to do it. That's okay. But I think there was more going on. So what happened is the seller got pissed. He says, I don't have to extend myself. There's so many cases I knew about that the one of the two parties in a divorce was going to come into a huge settlement. Another one is a big business guy. So like 3-4 people were pending, staying in touch with the doctors. He knew this was going to happen at any time. But in the contract, again, he's only an employee. In the contract, it doesn't say that the seller is obligated to inform the buyer of future prospects that haven't materialized yet because the people don't have the money now. But he just knew about them. And he said to me, in the terms of the contract, I don't even have to tell him about these doctors, or these patients who were wealthy and had even more money coming in and swore that they were going to do a full mouth rehab. He says, I'm so pissed. He says, I'm not obligated to help him with the lectures either. It's just not a good feeling. You shouldn't do this as a buyer and burn your bridges. That's essentially what has happened. In the short phrases, my eyes are killing me. Oops, excuse me. Got a sunny day in New Jersey. The buyer said, I got everything under control. I don't need you anymore. What a huge mistake that is. You should realize, first, people are sensitive. Second, the seller built the practice from the bottom up. He remembers every screw, every nail that went in the wall. He remembers the equipment, even though some of it may have been old at the time. Now it's old. He still remembers buying it, how exciting it was. And that goodwill is very valuable. And you've got to understand that a lot of young buyers don't. Using those cliches like, I got this, like, I got everything under control. Yeah, okay, tell me about it. He knew the patient, or she knew the patient for 35 years. Don't you think there's a lot of goodwill there? Rather than saying, I got this. And not showing respect to that seller is a fatal mistake. Fatal. Should never do that. But this buyer did it. And the record sale, that buyer also had a little attitude. I got everything under control. I don't need you. I don't need you. I got everything under control. The new buyer of the records never met the patients. And they figured I'm going to figure out, they're going to figure out everything? It's so foolish. But that's what happened. And you have a seller that's irate, a seller that's upset, a seller that's saying, I'm not going to, go outside the guidelines of the contract. I don't have to make them successful. I'll do whatever I want. A really upset seller. He just insulted the seller. That's essentially what happened. And the ramifications of that are far and wide. The buyer will never know what they just gave up. The buyer of the records will never know what they just gave up. They just figured everything. They got everything figured out because they used the words, I got this. Yeah, tell me about it. You have nothing is what you have. You're foolish. Unbelievable. And the seller was willing to, reach out and see what he could do to help out to the new buyer of the records. No, they used the words, I got this. Yeah, okay. Crazy enough. These things happen. Respect your seller. Respect that goodwill has a lot of value to it, far more than you think. And that seller knows more than you'll ever know about certain patients and so forth. So extend yourself in the future. All right, thank you, team. Bye now.